2025 has been set aside as Health Week, starting from today, in all Baptist churches throughout Nigeria. So in any Baptist church you go to today, there will be one or two people, gathered together to anchor this program, just to enlighten us. And it's a beautiful thing. This is a yearly affair. We've had different topics over the year. And this has been very enlightening to our members, who are also members of the nation, and they need these health talks. So this year, the topic that has been set aside is you and your liver. When I came in, I took the bulletin and I read something, I read it right up there on you and your liver, and I was very impressed. This summarizes exactly what we want to, share with you today. So I'll be walking through the slides, and you please pardon me because immediately after this presentation, I have to get back to church to join my other people there. So let's have the next slide, please. Now, the expected learning outcomes, we can all read. One is introduction, functions of the liver, common diseases of the liver, common causes of liver diseases, and then take-home messages. Next slide, please. Expected learning outcome. I don't know whether you can read it from there. Participants, that means the health workers. We had to go into a forum like this where one of our consultants, presented to all of us. And we, as members of that forum, the medical professionals, we are expected to go back to our own churches and let our congregation know about this. So, we also have abstinence from excess alcohol use, which we have to get to know today, and the reasons why. Then voluntary testing for viral hepatitis infection, which is very common. It's a very common liver problem. And then we are to be told about seeking the services of qualified health care professionals whenever the need arises. Not listening to people outside who will say they know this about this herb or about that herb which has worked for somebody or somewhere before, and they want you to come and try it. It's always better, within our churches we have doctors that you can give calls to and seek advice. I wouldn't mind dropping my phone number. In case of any advice, you can call me. We are members of the same family. So let's go to introduction. The liver, we all know, we hear about liver. In Yoruba, they call it edo. I'm sure a lot of us have probably eaten liver from animals before, and it's almost the same thing. It's the largest internal organ of the body, and it is located in the right upper quadrant. That's upper quadrant of the abdomen, and hidden under the ribs. It's protected by the ribs. And the liver receives blood uniquely both from an artery and from a vein called portal vein. The vein that supplies the liver drains blood from most other organs in the abdomen. Next slide, please. Now, this is a picture of what the abdomen looks like. Oftentimes, we hear in the clinic people say, I have stomach pain. They refer to everything here as stomach, whereas stomach is just an organ, in the abdomen. So the whole thing here is abdomen, and we can see different organs that are there. You have the liver at the topmost right quadrant, and you have the stomach underneath it, then the intestines, the bile, the pancreas, they are all there. Next slide, please. This is a better picture of what the liver looks like. You can see it reddish, and then the stomach underneath it. Then you have the green one, which is the bile. Now, what are the functions of the liver? Next slide, please. The liver performs about 500 functions daily. Isn't that amazing? Just one organ, 500 functions daily. And then some of them are production of bile. That is, they call it oro or something in Yoruba. Production of bile, which is important in the digestion of fat. We all eat fat through, beef. Is it beef? Is it through the oil, margarine, and all sorts? It has to be digested. So the bile that we digest is produced in the liver. Then storage of fat-soluble vitamins A, D, and K. Synthesis of albumin. Synthesis of anticoagulants and procoagulants. What we mean by anticoagulants is that these are the substances that does not allow the blood, as it is flowing through us, to coagulate, to congeal, so that it can flow always. Then detoxification of harmful substances. Oftentimes, when we eat, we consume harmful substances that we don't even know about. So the liver is there, to detoxicate the substances and keep our body healthy. It also maintains constant blood levels of glucose and amino acids. Then synthesis of cholesterol, which is important in fat digestion. Then metabolism, that's handling of alcohol. A lot of us, some people, I'm sure not among the Baptists, drink alcohol and probably drink in excess. And then the liver is there to protect the body, if it is done, minimally. Then you have storage of minerals like copper and iron in the body. These are functions of the liver. These are just some of the functions. Remember, we mentioned 500 functions on a daily basis. Now, we go to the common diseases of the liver. Number one is hepatitis. I'm sure we've all heard about hepatitis. We've all had cause to do hepatitis test in the past, and then there's always a reason for doing it. Then we have liver abscesses, which can be very drastic. Then we have metabolic dysfunction associated with steatotic liver disease. That has to do with fat. Then we have liver cirrhosis, which has to do with fibrous tissue growing in the liver due to excessive alcohol consumption. Then we have the liver cancer. We have liver cysts, and we have benign tumors of the liver. We shall be touching all these things briefly as we go on. What is hepatitis? In the medical language, once you hear itis, something ending in itis, cholecystitis, something itis, it always means inflammation. So in this case, hepatitis is inflammation of the liver. And then response of the liver to injury of any type. Hepatitis can be acute with a short duration, less than 6 months, or it can be chronic with a long-term duration above 6 months. Hepatitis, acute or chronic, sometimes may be asymptomatic or symptomatic. Asymptomatic in the sense that people who have it may not even know that they have it, because there are no symptoms. It can also be symptomatic when there are signs, that the liver has a problem. The symptoms that one can see in hepatitis include fever, which is due to the inflammation, malaise, upper abdominal pain, especially around the liver, yellowness of the eyes because of the bile production which seeps into the bloodstream. It can give us that jaundice. That's what we mean by yellowness of the eyes. Then we can have passage of dark-colored urine because, the bile will be synthesized. It will form bilirubin and urobilinogen, which is excreted through the urine, and then the color will change to brownish. In acute hepatitis, the blood levels of transaminases, those are the enzymes produced by the liver. And those are the things we test in the blood to know whether there's a liver function problem. These ones, in hepatitis, these transaminases can be very high. So once we do liver function test and we see these enzymes to be very high, we get worried and then we have to probe further to know what is going on. Acute hepatitis can lead to death, and sometimes it can get resolved, or it can lead to chronic hepatitis. Chronic hepatitis is usually asymptomatic too, even though there's continuous destruction of the liver. You may not have any symptoms. That person may not have any symptoms if he has hepatitis, but the damage is being done. And that is why they are called, hepatitis and some other illnesses are called silent killers. Silent killers in the sense that the person is well, going about his work, not knowing that damage is being done on the ground. Chronic hepatitis may lead to the replacement of the liver tissue by fibrous tissue. That is in cirrhosis. That is the normal tissue of the liver which performs its normal function. It can now be replaced by fibrous tissue, which is cirrhosis. And you know fibrous tissue, Yoruba says, Ojo akpa, odabi ojo ara. The fibrous tissue will not be able to perform the function that is needed of the liver. Next slide, please. We have a picture there of a healthy liver and a cirrhosis liver. You can see the fibrous tissue, the big difference. So you know definitely that this one, the yellowish one, cannot perform the work of the normal liver. Now, what is liver cirrhosis? Liver cirrhosis is diffuse replacement of the liver tissue with fibrosis and nodular generation. It is the result of persistent injury to the liver, and the liver is not able to perform its functions again, like I've mentioned. The worst of all is that it can lead to liver cancer. Cancer is something that we all dread. Researches are going on, but no cure yet. So liver cirrhosis could be asymptomatic in the very early phase, like I mentioned. Next slide, please. Now, we have a picture of somebody there who has liver cirrhosis, which has led to a collection of fluid in the abdomen. And then you see this protruding abdomen. Yoruba people will say, when they see things like this, they will say, Odeku. This is not about Odeku. This is about a life-threatening problem. What are the clinical features of liver cirrhosis? They include tiredness, fluffy hair, you see changes in the hair, yellowness of the eyes, redness of the outer parts of the palm, whitish nail, you see the nails whitish as if the person is pale. Then there's reduced protein in the blood. Those are the tests, blood tests, some of the blood tests that we do to know that there's a liver problem. There's hypoproteinemia. There's enlargement of the breast in males, enlargement of the breast in males, which is called gynecomastia. You see some males with enlarged breast, just like a female. It is not normal. Then it can also lead to testicular atrophy in males. The testes shrink, it's atrophied. That's what we mean. All this can be seen in liver cirrhosis. Next slide, please. Liver cirrhosis can lead to complications. I will just read through. I'm not sure whether you can read it from where you are. We have hepatic encephalopathy. That's neuropsychiatric manifestations due to the failure of the liver to remove toxins from the blood. There are a lot of toxins circulating in the blood, and liver is one of the organs that remove these toxins. Another organ that do that is the kidneys. So if these toxins cannot be removed effectively from the blood, it can get into the brain, and one can have neuropsychiatric manifestations. Then we have ascites, which I've mentioned before, which we saw in the previous picture, in the previous slide. That's abnormal accumulation of fluid in the abdomen. Then we can have esophagogastric varices. That's enlargement of the blood vessels in the esophagus. The esophagus is somewhere here. So the blood vessels there can get enlarged, and that's what we mean by esophagogastric varices. Then it can lead to liver cancer. Those are complications that can arise from liver cirrhosis. Next slide, please. Thank you. Next is treatment of liver cirrhosis. Well, one should not, deliberately harm himself or herself, thinking that, there's a solution, treatment somewhere. It's always better to keep safe. Prevention is better than cure, like the doctors will always tell you. Now, how do we treat liver cirrhosis? We are talking about liver transplantation, which is the definitive treatment. That's a very complex thing. And as of today in Nigeria, maybe very few centers can do that. So it's better to just keep safe. Next slide, please. Yes, thank you. Another topic you'll be treating is the liver cancer. Cancer is a dreaded word. And I pray that none of us will go through that experience in Jesus' name. Cancer is an abnormal growth in the body that does not subject itself to the control system of the body. It does not subject itself to the control system of the body. God has created us. There are mechanisms that protect the body. But this particular sickness, in fact, research is going on day and night. There are people who are not sleeping because of this sickness. And yet, no treatment. So there are two forms of liver cancer. The primary one, which arises from the cells within the liver, and the secondary liver cancer, which is spread from organs around. Metastatic spread can happen. If one, for instance, has cancer probably in the skin, it can spread and spread to the liver. Those are the secondary ones that we are referring to. Next slide, please. The primary liver cell cancer, there are two types of that as well. We have hepatocellular carcinoma that arises from the numerous cells of the liver called hepatocytes. The body, the tissues are made up of cells. So the cells that are in the liver are called hepatocytes. So when these cellular now start growing abnormally, it leads to hepatocellular carcinoma. Then the second one is cholangiocarcinoma that arises from the bile duct cells within the liver. The bile duct cells was shown in the previous slide somewhere. So hepatocellular carcinoma is the more common of the two types, especially in Nigeria. It is usually asymptomatic in the early phase, just like every other cancer. In the early phase, you may not have any symptoms, but it's always good to be vigilant. Report any health issue to your health practitioner. When it is necessary to do annual check or medical check, whether annual or every 2 years, don't miss it, because the earlier this thing is detected, the better. And the better outcome one can have. They are easily treated, when seen early. Next slide, please. Yes, we have a picture of a liver with hepatocellular carcinoma. You can see the wound there. A wound that usually does not heal. And once you see something like this, you can be very sure that that liver will not be able to perform its function. And then there's danger of the cancer spreading to other organs, to the brain, to the heart. So life expectancy, next slide please. Life expectancy of people with symptomatic hepatocarcinoma in Nigeria is about 3 to 6 months. So you can imagine a diagnosis is made, and once that person is told about this, that person is expecting, to live for 3 or 6 months more. In advanced countries, it could be better. May God help us and help our health institutions in Jesus' name. So this is the rationale behind screening those who are at risk of hepatocarcinoma. With abdominal ultrasound, blood tests, that test is called alpha-fetoprotein, every 6 months. Those who are at risk, I'm not saying everybody, but all of us as we age are supposed to go for medical checks from time to time, depending on the age. For the young ones, well, they may not bother, but for the elderly ones, it could be every year or every 2 years. Let's check all these parameters. Not only the liver, the kidney, the heart, all these things can be checked. These days, there are packages in some of these diagnosis centers. There are packages that will check everything for you at a reduced price. Okay, thank you. Next slide, please. Okay, the definitive diagnosis of this cancer, of the carcinoma, is through triple-phase abdominal CT, that's abdominal computed tomography, or liver biopsy. Liver biopsy is the main test, the last test that is done. They take part of the liver and do histology test, and then they will identify the cancer cells there. So, very early disease, curative modalities like liver resection, liver transplantation are all done. Can we have the next slide, please? Okay, thank you. Just for information, what we normally do, we do transarterial radioembolization, or they do transarterial chemoembolization. Those are what they mean by TACE and TARE. This chemotherapy, these procedures in Nigeria are very expensive. And with the present situation of the economy, health is not cheap anymore in Nigeria. So we need to be careful. We'll get to where we'll outline what needs to be done, to prevent all this. Now, we also have benign liver tumors. What they mean by benign is that they are not cancerous. There are tumors. There can be swelling, growth in the liver, but that they are not cancerous. That's what we mean by benign tumors. These are abnormal growths that are not cancerous. They are more common in females who use hormonal contraceptive. They are usually asymptomatic, although they can sometimes cause pain or rupture. And the treatment is to do nothing, though they can be removed if they cause symptoms. If they cause symptoms, they can be removed. But usually we advise watchful waiting. You just watch it and observe yourself. Then, next slide. Another thing that can happen to the liver are the liver cysts. These cysts can happen in other organs as well. These are usually cavities that are filled with fluid. That fluid can be serous fluid. It's not really water. It can be serous fluid, and exudates from the blood. Simple cysts are usually discovered incidentally while undergoing abdominal scan for something else. Somebody has abdominal pain. Probably we are thinking of appendicitis, and the person is sent for abdominal scan. And in the scan, they will see that there are cysts in the liver. So the patient may be asymptomatic because the patient will not feel anything, but the cysts are there. So there are different types of cysts. You have the hydatid cysts, which are caused by parasites. In the tropical countries, there are a lot of parasites in the blood system. Some can get into the liver and cause cysts. Then we can have liver cysts also as parts of polycystic kidney disease, which is a genetic disease. Next slide, please. Cysts can also be cancerous, and the only way to diagnose them is through abdomen, USS abdomen, or through CT scan or MRI. So next thing we'll be discussing is liver abscess. These are part of, problems that can arise from the liver. An abscess is a pus-containing cavity. It's also a cavity, but what is inside that cavity is abscess. That's pus, And before you can get to that stage, a lot will have happened. Now, common causes of liver abscess include bacteria, or a parasite called amoeba, and also trauma. A trauma too can lead to abscess of the liver. Depending on its cause, it may be single or multiple. Even though liver abscess is rare, it occurs more commonly in those that have diabetes and immunosuppression. Those are the HIV patients where their immunity is compromised. Symptoms of liver abscess include right quadrant abdominal pain. In fact, whenever one has pain in the right quadrant here, the first thing you think of is the liver. And a scan will show what exactly it is. The treatments that is given for abscess include antibiotics with or without surgery. In the next slide, we have the common causes of liver disease in Nigeria. We have infectious causes, we have viruses, we have bacteria, we have parasites. These are things we do not always see with ordinary eye. But with improved hygiene, let me just use that wide word, improved hygiene, one can, avoid all these viruses, bacteria, parasites, and so on. Then another thing that can cause is excessive consumption of alcohol. Yes, we still have people who, despite this economic situation, still consume alcohol in excess, especially when it is free. Then excessive deposition of fat in the liver, and then drugs and toxins. A lot of people indulge in self-medication. They go to the pharmacy, they listen to people outside, buy this, buy that. It is after trying all that, not knowing that damage is being done gradually, unseen. Now, let's come to hepatotropic viruses. Yes, we have the hepatitis A virus, the hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. Hepatitis B virus is the most common, and I will dwell more on that. Hepatitis A, C, D, E are not that, common, although they are there. So let's go to hepatitis B virus. Next slide. Next one. Yes, thank you. Now, this is the most common of all the hepatotropic viruses, having affected over 2 billion people worldwide. Hepatitis B infection has been designated an international public health challenge. It has gotten to that stage. And there are 1.2 million new infections every year. And it causes about 1 million deaths every year, largely from liver cirrhosis and hepatocellular carcinoma. And at least 8 out of every 100 Nigerians have chronic hepatitis B infection. Some may not even know about it until tests are carried out. So next slide, please. Now, it is responsible for 60 to 80% of liver cirrhosis and hepatocellular carcinoma in Nigeria. Unfortunately, majority of people with chronic hepatitis B do not know. Do not know they have the infection, even though the virus may be destroying the liver slowly. This is why hepatitis B is classified as a silent killer. The Society of Gastroenterology and Hepatology in Nigeria advice is for all adults, especially those born before 2004, to screen at least once for hepatitis B infection. Why they mention that date is because these days, hepatitis B vaccine is part of national routine immunization. So children that are born these days, they usually take the vaccine to protect them from hepatitis B. What are the routes? Thank you. What are the routes of transmission of hepatitis B virus? How do people get the virus? One, hepatitis B virus is transmitted through blood and body fluid. through blood and body fluid. It is about 100 times more infectious than even HIV, and at about 50 times more infectious than hepatitis C. The virus can survive at least 7 days outside the body, and this means that the blood or body fluid can still be infective. We should avoid coming into contact with body fluid of other people. That's what it means. Even your close relatives. You don't just touch blood anyhow. Even in hospitals, we don't touch blood anyhow. We have to use the gloves. So avoid touching body fluids of another person. Now, the routes of transmission can be vertical, mother to child. Mothers, when they are pregnant, exchange blood through the placenta with the babies. And there can be, transmission through that way. So this is the reason why hepatitis B clusters in the family. However, not all pregnant mothers will transmit the infection to the baby, because the risk of transmission depends on the E antigen and hepatitis B DNA viral load. That you may not bother yourself about it. So the risk of transmission increases significantly when the mother's hepatitis B antigen is positive and the mother's DNA count is greater or equal to 200,000 international units per mil. When the child acquires hepatitis B virus from the mother, the risk of becoming chronic is more than 90%. So we have to do everything possible to make sure this vertical transmission line is broken. So this is why hepatitis B screening should be done for all pregnant women. It is part of the ANC screening that is done through the antenatal clinic. So there is child-to-child transmission as well. This is another reason why hepatitis B infection clusters in the family. This occurs because members of the same household, they tend to share many things in common. They eat together, they use the same toilet, they do everything together, and there can be child-to-child transmission there. Although for the children, usually they are immunized, but at the same time, we'll have to see something we can do to that. Now, another thing that can cause transmission is indiscriminate use of sharps. What we mean by sharps is anything that is sharp, needle, blade, and so on. So this can happen through circumcision. Sometimes some people, when they want to circumcise their babies, they go and call one woman they know, or a nurse that they know that can do it, and they do it at home. This is not advisable. Ear piercing, tattooing, tribal marking, sharing of blades, nail cutters, climbers. You call the malam to come and do, what do they call it? So to come and do pedicure, whatever. All these people use unsterilized sharp instruments. In the hospitals, every sharp object, in fact, most of the needles we use in the hospital now is single use. You don't even sterilize. Just use and put in the sharps box. And there's a box, special box, we call sharps box, so that that needle does not pierce another person and transmit all these these things we are talking about. Now, another route of transmission of hepatitis B is through unscreened blood transfusion. Some people are sick, they need blood, and I won't say the doctors, maybe the quacks, they think they can just pick blood anywhere and give. We've had cases of, children needing blood, and the father will come up and say, take my blood now and give. And we say, no, it is not done. Every blood before transmission must be screened at Lagos State University Teaching Hospital and stamped and given a number. If any doctor transmits any blood that is not screened with that number from lawsuit, it is 7 years jail. So they are not taking it easy with blood transfusion at all. So we should not indulge in unscreened blood transfusion. Then unprotected sexual intercourse as well. These are things we should abstain of. I'm sure as Christians, we are being careful about that, just as our Lord has admonished us. Thank you. Diagnosis of hepatitis B virus infection. How do we detect hepatitis B virus infection? It is mainly through blood test. The test is available and affordable and is cheap. Anybody can walk in and ask to be screened for hepatitis B. So after hepatitis B virus infection is diagnosed, it is important to determine whether it is acute or chronic. This is because the approaches to management differ in each case. Acute hepatitis B infection is the carriage of the hepatitis B surface antigen for less than 6 months, and above 6 months is chronic. So let's go to clinical features of hepatitis B. Next slide. Next one. Thank you. Acute hepatitis B infection may be asymptomatic, like I've mentioned, especially in children. It can also be symptomatic. It can be mild or severe. It can be ectatic with jaundice, and it can be without jaundice. So it does not mean that it's only when one has jaundice that that person has liver issue. Usually it starts with constitutional symptoms like malaise, fever, body pain, and it is only when those tests are carried out, like the enzymes produced by the liver, the antigen test, that one can detect that there's hepatitis B. What are the clinical features? Okay, we've mentioned that, and why it is called silent killer. What is the management? Next slide. Okay, thank you. The management of acute hepatitis B is supportive, even when symptomatic. What they mean is that, you know, this is a viral infection, and most viral infections do not respond to treatment. Even though there are so many drugs that are being tried today, it is the case, same case with HIV, it is the same case with other viral infections. Even catarrh that we see is the same case with it. Sometimes when you have catarrh and you take drugs and take drugs and take drugs, the catarrh will still run through its own course, which usually takes 7 days, and it will go. You know, I remember when I was in school and we attended the lecture on this topic, and the lecturer said, if you are treating catarrh with drugs, it will take 1 week. Without drugs, it will take 7 days. So he was basically talking about the same thing. It's a viral infection that will run its course. And then, so these are the viral infections. So what we do in hepatitis B infection is we do supportive therapy. And this includes bed rest, avoidance of other dangers to the liver, like unnecessary medications, alcohol, herbs. Most of the adults with acute hepatitis B will clear the infection before 6 months. But when acute hepatitis B is severe, liver transplantation is the definitive treatment. Now, in the case of hepatitis B infection, which is chronic, the objectives of evaluating the patients include to determine the state of the liver of the patients, determine whether the patient has only hepatitis B or with other hepatotropic viruses or with HIV. And then we determine the eligibility for antiviral treatment. What are the management for chronic hepatitis B infection? We have to discuss this because it's a common thing we see. Don't forget that they said 8 out of 100 Nigerians are carrying this virus, some without knowing. So all patients with chronic hepatitis B infection should be linked to the treatment centers, which are mostly found in tertiary hospitals in Nigeria. Important history to be taken from a patient with chronic hepatitis B include how and when the patient was found to have hepatitis B infection, symptoms of hepatitis or liver disease now or in the past, family history of hepatitis B or liver diseases, history of alcohol consumption, cigarette smoking, or substance abuse. Next slide, thank you. All patients with chronic hepatitis B virus infection should be examined generally and for signs of liver disease. Almost all patients with asymptomatic chronic hepatitis B will have normal physical examination. This patient should then be evaluated with the following tests. 1, abdominal ultrasound, that's a scan, to scan the liver and the entire abdomen for features suggestive of any liver disease, and then liver function tests, which I've mentioned before. These are tests that are readily available. Then hepatitis B serology, then full blood count. We also screen for HIV because it's also a viral infection. Then we test for hepatitis C and D viruses. So please note that all patients with chronic hepatitis B must do all these tests. What are the criteria for treatment of patients with chronic hepatitis B? Sorry, I'm taking your time, but I will quickly run through what we have here now. It's a lot. Can we have the next slide? Let's just go to the important ones. Okay, yes, thank you. Now, what are the follow-up for those who do meet criteria for treatment? Those who do not meet criteria for treatment at the initial evaluation should be evaluated periodically 6 to 12 months. That is, when they are evaluated and they don't need treatment, it does not mean they don't need treatment forever. We have to evaluate every 6 to 12 months. That the patient does not meet criteria at the initial evaluation does not mean the patient may not need treatment later in life. And this is because of the dynamic nature of the interaction between the body and hepatitis B virus. This is why the follow-up of patients with chronic hepatitis B infection is lifelong. Next slide, please. Next slide. Okay, let's go to treatment of chronic hepatitis B. Like we have mentioned, there's no cure. However, we do follow-up treatment. And then the goals of treatment are to reverse or at least stop progression of hepatitis B, and to make the hepatitis B DNA count undetectable or less than 2,000 international units. Next slide, please. Next one. Okay. We have drugs for treatment of chronic hepatitis B, which may not really be of interest. We have the tenofovir, entecavir, lamivudine, pegylated interferon. These are drugs that can be used. Now, next one. Okay, most importantly is vaccination against hepatitis B infection. Like I said in the past, babies born now are usually vaccinated at birth. For adults, if they screen and it is negative, there are vaccines they can take to prevent any infection. This definitely will be explained to you by your health practitioner if you visit them. So the vaccines for adult vaccination is not the same as the one that is used for children. The one that is used for children is specially formulated for them, and the dosage differs from the one that is meant for adults. Next slide, please. Yes, this is very important. Prevention of mother-to-child transmission of hepatitis B infection. Prevention of vertical transmission of hepatitis B is very strategic in preventing chronic hepatitis B, as more than 95% of vertically transmitted infection will progress to chronicity. So all pregnant women should be screened during antenatal care. Those that are positive should be evaluated as in other persons who are not pregnant. If they meet criteria for treatment, tenofovir is usually used. Women who are already on tenofovir before pregnancy should not stop. This will be explained to you by your health practitioners. Now, how do you prevent? Okay, we are still on the same topic. I will go on. Evaluation for risk of transmission of hepatitis B virus infection should be done at 24-28 weeks gestational age. You know, the mother should be commenced on tenofovir at 28 weeks, if need be, after evaluation. Usually, when the babies are born, before they are breastfed at all, the mothers, they have to take hepatitis immunoglobulin, and the child has to start active immunization after birth, so that to prevent this transmission from mother to the babies. Next slide, please. Okay, we can go on. Next slide. Next slide. Next one. Okay, we want you to note the following about hepatitis B infection and its management. One, it is dangerous to say that a person with hepatitis B does not need treatment. We have not said so. Supportive therapy is what we advocate. And then evaluation for drugs when need be. This can be done by the doctors. Next slide. Next slide. Next. Well, hepatitis C virus exists, but we will not dwell much on it. Okay, let me just briefly talk about hepatitis C virus. It affects about 50 million people worldwide and was responsible for about 242,000 deaths globally. The prevalence of hepatitis C virus infection in Nigeria is about 1.1%. And it's essentially a blood-borne infection spread through unsafe injection practices, blood transfusion, sharing, intravenous drugs abusers, and use of unsterilized medical equipment. This does not go through mother to baby. It does not go through sexual immorality. So let's just go on because the thing is many. Go on. Next slide. Next slide. Next slide. That's hepatitis. Next slide. Hepatitis D virus also exists. Next slide. Next slide. Yes. Hepatitis E virus also exists. Next slide. Let's go to excessive consumption of alcohol. Next one. Okay. Excessive consumption of alcohol, what it can do. We've mentioned this severally, but I'll just run through again. The liver is the earliest, most affected organ by alcohol. And it is not everybody that drinks alcohol will develop alcoholic liver diseases. It depends on the quantity and the consistency. So it can lead to alcoholic fatty liver. Next slide. Abstinence from excessive alcohol may reverse it back to normal, and usually there may be no symptoms. Let's go on, just go on. We'll go to the take-home messages so that I can round up. Okay, let's stop here. Now, what are the take-home messages from this lecture? Check your hepatitis B status at least once in a lifetime. Get vaccinated if negative, and avoid exposing yourself to routes of its transmission, as stated earlier. Get evaluated by a doctor knowledgeable in hepatitis care if you are positive. Avoid taking alcohol, and if you do take, it should not be excessive. Avoid smoking. Check your hepatitis C status at least once in a lifetime as well, and avoid exposure to its routes of transmission. We have mentioned that. Pregnant women should attend antenatal care where screening for hepatitis B should be done. Parents should ensure children have all the routine vaccinations as scheduled in the National Program on Immunization. We cannot afford to forget these. The girl child should not be circumcised. Boy child should be taken to the hospital for circumcision, where sterile equipment will be used. Girl children should have ear or nose piercing done, if it is the preference of the parents, in health facilities where sterilized equipment are used. This is very important. Avoid the use of unprescribed drugs as much as possible, and take those prescribed according to medical instructions. Regular exercise and balanced diets are good for the liver. Refrain from the use of unverified herbs and supplements, There are so many of them, herbs, supplements, so many. One thing I tell my patients is that, yes, you are buying this, you are using it. Do you think those people who manufacture these things, they don't want to sell it? They want to sell them. So they will do everything to convince you that it will work so that they can get the money. So it's better you visit the doctors. Refrain from then maintain a healthy weight. Go on. Next one. Thank you for your attention.
Thank you so much, sir. As church, can we put our hands together once again? We indeed want to appreciate you. We know you have a